Well, good afternoon, everyone. Good afternoon, Dr. Vequist. How are you?
Very good. Thank you. Thank you for having me today.
Yeah, I'm so excited that you're with us. I just wanted to briefly let everyone know that Dr. Vequist and we have, I believe, first met for an event, the State of Medicine here in Bexar County with the Texas Tri-County Chamber of Commerce. And we have gotten to know each other, and we have a lot of overlapping interests in the field of medicine. And you are an expert, internationally recognized expert, of course, in the field of study of medical tourism, and that has always been something that was relevant to me. And if our viewers here want to participate in this conversation, please feel free to use the comments under the video. They should feed into our studio system here, and then we can interact with you that way. I came in 2011. I came from a very socialistically minded country, Luxembourg, small country in Europe, landlocked by France, Germany, and Belgium. And we have a universal single payer system there. And what that means is that essentially you, as a consumer of healthcare, have absolutely no idea how it's paid for, and you don't actually want to know. It's just kind of, there's one thing, you go to the physician, and everybody has the same rates, and the reimbursement rates are the same, and for the most part, very often you don't even have to put money on the table. You don't have to show an insurance card. Everything is integrated in one big system. And when I came to the United States, obviously this was a very different scenario. I learned a little bit the hard way that my student insurance that I got at my university was not necessarily the best insurance to take to the local hospital, which at the same time had a monopoly there in that little city in the middle of nowhere in Ohio. And I got my first surprise bill relatively early here. And that got me on a path of really understanding what are healthcare delivery alternatives in the United States. And I got very involved in the Free Market Medical Association. I actually co-run the chapter here in San Antonio with Dr. Roger Mochigemba. But that's enough about me. I want my audience to get to know you, Dr. Vequist. What is your passion? What has gotten you into this? And why do you think medical tourism is important? And what is it? So much at once.
Sure. So, a little bit about me. I've been a professor for 20 years now, a little over 20 years, with the University of the Incarnate Word. For those of you that aren't in South and Central Texas, the university is a very old university from the 1800s, and it is one of the only private universities in Texas that has a medical school. And we also are the third largest private university in Texas, and one of the largest Hispanic serving universities in the United States, particularly west of the Mississippi. The Center for Medical Tourism has been around for a little over a decade now. I'm the founder and the director of the center. Prior to that, I was an executive with HCA, and then prior to that was a consultant with Ernst & Young. Really got passionate about the area of research of medical tourism, coming from a background, particularly in the 90s with Ernst & Young, and seeing a lot of outsourcing of services, particularly to places like India. And then in healthcare, particularly seeing the very large numbers of people that were coming into the United States, particularly here in San Antonio, to access healthcare at American facilities, particularly by Mexican nationals and people like that. So that kind of got my interest going. And so as a professor, I ended up picking that as my research agenda and had started researching that and developed the center, which, as I mentioned, has been around for about a decade. It's that's kind of where my passion for it came from, and then from studying these flows of patients traveling, not only internationally but also domestic. Domestic medical tourism is a thing that we'll be talking about today. I found that there was some simple economics and business trends that were underlying this. One of them is the growth of technology. The modern medical tourism, as it exists now, exists because of the information that's available primarily through the internet. We find that upwards of 60 to 70% of the decisions that people make about going to healthcare facilities now, particularly in a medical tourism environment, domestic or international, is based on information they found on the internet. The amount of searching and using the internet for medical information, healthcare information is massive. Google suggests that it's upwards of 7% of all total Google searches are healthcare related. And then a few years back, Pew, the research firm, did a study and found that when it came to utilization of the internet, number one use of the internet was the use of email, number one. Number two was social media, and number three was using healthcare resources, sites, applications, searching for healthcare, things of that nature. So, healthcare and information on the internet are ubiquitous. They go together because the healthcare is life, and so patients and people are looking for better healthcare, and so that kind of really drew me in more and more and developed my passion for this. The other thing fascinating, as you mentioned, the Free Market Healthcare Association, which you've been involved in, and I'm very glad that you're here in San Antonio and helping with that, is that we find in medical tourism that most patients, and this is around the world, tend to go to private facilities as soon as they have a choice. Studies, for example, done in India, that as soon as impoverished Indians have access to some form of insurance, whether it's through, say, the national government or something they purchase themselves, or if they're given options through a nonprofit or other, as soon as they have choices, they choose a private facility. They stop going to the state facilities. And even as you pointed out, in Europe, where we have a lot of single payer systems, the Europeans are some of the most frequently traveling people in the world for healthcare outside the country. Probably not quite as much as, say, people in the Middle East, but in China, but for having good healthcare systems in their countries. About 4% of Europeans, in a study a few years back, traveled outside their country for healthcare. That's almost 3 times as high as it is in the United States. So apparently people in Europe are finding that there's still things that they need or want that they can't get in their own country, and they're going elsewhere for it.
Mm-hmm.
That's kind of a little bit of healthcare, medical tourism. Healthcare in a nutshell for me is it's about choices. It's about the ability to look for what I want, when I want, how I want it, when I want it, where I want it. So it's patient consumerism. And we've seen that increase significantly, greatly, particularly in the last 3 decades, particularly with the rise of the internet. So healthcare consumerism is here to stay.
Yeah, and we as free market proponents really believe that is also one of the strongest ways to bring fairness, equity, price transparency into the system, because healthcare is this weird aspect of the economy here in the United States where very often you purchase a service without knowing what it's going to cost you, and the idea that we have accepted that somehow is weird, but that's a whole different topic. I just think it's really beautiful how you describe it as it being choices for individuals. And I remember when you told me once what really uh, is so interesting to you about the field studying healthcare is its intricacies, its complexities. There's so many different things that come into play, but of course also knowing that by studying and understanding you can help people get access to what they need. And one aspect of medical tourism that I want to ask you about is, okay, so there's international medical tourism, and then there's also domestic, as you mentioned, medical tourism. And then there's also the medical tourism that you might not have thought about, because I want to assume you talk from the patient perspective, but there is a whole aspect of medical tourism on the healthcare provider side that is also going on, and that is also part of the solution of making healthcare more affordable and also accessible. So the domestic medical tourism is something that I think is also a very powerful aspect, because in the free market medicine community, for example, we have surgery centers that are popping up around the countries. And for example, here in San Antonio, for someone who is willing to travel to a surgery center in Oklahoma or even in Austin, um, being willing to travel for 2 hours can sometimes make a difference in thousands of dollars. And what are you seeing there, Dr. Vequist, in terms what is growing faster, actually, the domestic medical tourism or the international one?
Yeah, that's a great question. So, looking internationally, just as what our future might look like, there was a Gallup study that looked at 14 different countries throughout Asia, and Asians are more likely than Americans to travel outside their country for healthcare. For example, if you go into places like Korea and Thailand and Malaysia, you'll find many Chinese nationals that travel outside of their country. Where in China, there's limited access to good healthcare. There's some good healthcare in some of the big cities on the East Coast, but quite frankly, if they want really good healthcare, they go to private facilities in, again, places like Taiwan or Japan or Thailand or Malaysia or Korea. They're unlikely to stay home, particularly if they have any money whatsoever to go and get better health care. But interestingly, we found within those countries, 14 different countries studied by Gallup, there was about 25% of the population that traveled within country for healthcare as well. And so if you think about the western part of China, which is very agrarian, it's not the modern China that we sometimes see in the pictures. People that have only access to the public healthcare clinics in those regions, and they know that those are extraordinarily bad, and that people go into those and come out with infections or die from botched surgeries. They'll travel within China to go, say, to the large urban areas in Beijing or other places to be able to get better healthcare. So in the United States, we have some similar issues in terms of there are what is considered in the industry centers of excellence. There's places where excellence is tending to grow and prosper. Some of these you've heard of before because they have good reputations. Places like the Mayo Clinic or the Johns Hopkins or Cleveland Clinic. There's also places that you haven't heard of before. For example, here in San Antonio, we have two places that are on Walmart's list, and we'll talk about this case in just a second. Walmart's list of hospitals to send people to, like Northeast Baptist, which is sending people from all over the United States here into San Antonio to Northeast Baptist for a couple of specific types of surgeries that they tend to be extraordinarily good at. And then, as you mentioned, the Oklahoma Surgical Center, which is a fascinating case, has been basically getting more and more people from outside of their zip code region. Many of the people are not even coming from Oklahoma anymore. They're coming from outside the county and outside the state to come into that region. I expect that's going to increase. And we saw actually an increase of that during COVID as well. There were people in rural areas, for example, that were going to get COVID treatments into larger urban areas because there tended to be more expertise at treatment for the symptoms of the virus. So in general, the Americans, there's only about, according to a CDC study from last year, only about 1.3% of Americans go outside of the country for healthcare. And that's primarily Americans, but particularly grouping around the Southwest states, Texas, New Mexico, Arizona, and California, going into Mexico, which is the largest receiver, if you will, of medical tourists. Domestically, though, we have a couple different studies from CMS, or using CMS data, one done by some colleagues of mine at the university, that show that we're getting about, say, 10 to 20%, depends on the types of procedures and other things, of people that are traveling within the country, but outside of their town, city, county, or state for various different healthcare. And the biggest driver of that is obviously whether or not you've developed a reputation for quality, and then are you making that known? The old expression, if a tree fell in the forest but nobody was around to hear it, did it really fall? So if you have fantastic outcomes and you're a great physician, a great surgeon, a great dentist, but people don't know about it, if you're not making that available through digital media, then it's not really helping. The organic word of mouth, although is a very cost effective, has a customer acquisition costs is extraordinarily low, but it's difficult to get that ball rolling using just organic measures. You have to use inorganic measures. But in my opinion, so domestic medical tourism is one of the fastest growing trends that's happening in the United States right now among employers, particularly self-insured employers. These are companies that have rejected this. A good friend of mine from Lasso Software, which is a company here, refers to it as the matrix. It's a way that large companies are escaping from the matrix of healthcare, and they have found better ways to get access to healthcare for their employees. So let's kind of unbundle this. The large employers like a Walmart really care about their employees being healthy and well. If their employees are healthy, first of all, they pay less in health cost, whether they were fully insured or self-insured. We'll describe self-insured a little bit more detail. They tend to come to work more often. In other words, they are absent less, they call in less. When they're at work, they're able to be more productive. They don't have this, where they come into work, but they don't feel so well and they're not able to do as much and have to take a lot of breaks. So these employers really care about their employees. They want their employees to be healthy. They want them to be well, and they're willing to spend money in order to preventatively make sure that these employees are getting the health care they need. So Walmart many years ago, over 10 years ago now, started investing in these centers of excellence. And what they would do is they found that certain places around the country, like we talked about, particularly these well-known facilities, tend to have better outcomes. So Walmart then got rid of United and Blue Cross Blue Shield and some of these large healthcare insurers, and they went directly to the hospitals and the physicians themselves and negotiated wholesale rates, basically, or volume-based discounts, also called a bundled contract, with the hospitals and the physicians to get access to care for their employees. And they would get incredible savings. Some suggestions from one of the consulting firms that worked with Walmart many years ago suggested that Walmart may save thousands, if not tens of thousands, per every employee that goes on to one of these preferred providers. And in the insurance industry, it's also called kind of a narrow network, but it's basically a narrow network of specialized providers for certain procedures that they're particularly good at. So Walmart ended up saving a lot of money. And you think about it, they got millions of employees here in the United States.
Yeah.
2% of them go for surgeries every year, and they can get some of those surgeries to go to these providers, and they save thousands or tens of thousands each employee. That's saving some money. This has then led to a further revolution in terms of concierge medicine, the DPC or direct patient care practices, which I know you're very familiar with, and I just think the world of these because it's really bringing healthcare back to its original model, which is physicians working directly for patients to help patients be healthier. And it's such a breath of fresh air. And I just love seeing this spread throughout. So when not only do we have these hospitals and these centers of excellence that are increasingly serving more and more people, this is some numbers that are hot off the press, but as of 2019, we have some estimates at our center that haven't been revealed yet. We have a research paper coming up that show that about 1%, actually, quite frankly, over 1% of the total U.S. population, meaning over 3 million Americans, have access to a domestic medical tourism or a bundled contract through their employer to go to a specialist. So this is like a person that's making $12 an hour working at Walmart as a cashier has access to some of the best healthcare on the planet.
Wow.
And Walmart will fly them there, no cost. There'll be no out of pockets. They don't have to pay any out of pocket expenses for it. They'll be given a per diem when they travel there. They get to travel with a loved one to this facility, and they'll literally get access to some of the best healthcare on the planet. So people are making $12 an hour are getting access to the best healthcare on the planet because their employer cares about them. DPC is kind of taking that model and, if you will, democratizing it. And what they're doing is these DPC practitioners are allowing smaller employers to have contracts with DPC practitioners where they can then get access to care, as much care as they need, kind of almost, if you will, buffet of healthcare, primary care for these employers and their employees, and that's available for employers of all size. You don't have to be a large employer to afford this. And sometimes these contracts can be extraordinarily inexpensive compared to the health benefits that the employees receive, and it's just a wonderful model. So this domestic medical tourism, people being able to get access to care. Sometimes you may have to travel to get access to it, because here's one of the dirty little secrets in healthcare. The people that are in your local region may not be the best people to serve you depending on what you're needing. You may have to go to the next city, the next county, or other places. Now, there are models locally that can serve you, but it's kind of takes this network of both primary care and specialist to truly give you the quality of healthcare that you need. And so this is the next generation. This is happening quietly, and it's happening rapidly in healthcare. In fact, it's one of the fastest growing trends in American healthcare right now. Interestingly, it also integrates with the Dr. Michael Porter from Harvard Business School, his concepts of value-based healthcare. And this is all coming together, growing quickly. Most people in the public don't know, and it is delivering better outcomes than ever before, perhaps in the history of mankind.
Yeah, and what I want our audience to know is that this is not just theoretical talk, because I am a small business owner. I have about 10 W2 employees, and I'm walking this talk. My employees, including myself, we have a DPC membership, and then to cover anything that may go beyond what the DPC doctor can offer, we have very effective health share solutions that get very increasingly efficient, and you have everything available to you and even more that you would have under traditional health insurance. And moreover, I want to invite our viewers, if you are thinking about adopting that in your company, as even as a self-funded employer, I know that sounds a little bit intimidating because there's all these questions that come up. Well, how do I manage that? There's no longer a need to self-manage that, because we have health benefits advisors now that truly understand how this works. And for you as an end consumer, it feels very similar to just paying monthly premiums, but you have access to all of that expertise and that knowledge of shopping for the right pricing, of doing the bundled contracts, and all of these very specific fields of knowledge that will help you take advantage of that. So just reach out to me if you want to learn more about that. That's truly something I do within the realm of the San Antonio Free Market Medical Association. You can also go to sanantoniofmma.org, sanantoniofmma.org. There's a lot of information on there from the perspective of an individual, an employer, but also a healthcare provider who may want to tap into that, because that is something that I want to talk a little bit more. The medical tourism, the concept of medical tourism, the domestic one and the international one, becomes very accessible now with technology that has made it, quite frankly, very easy to engage and have a direct contract with a patient anywhere in the world, truly. What a lot of people don't know, for example, is that if you have a paid Zoom account, you can go into the settings and request a so-called BAA, which is something that US-based healthcare providers need to meet HIPAA compliance. And then you have a HIPAA compliant video channel with which you can interact with your patients. And I just want this to be known, that there is huge opportunity in technology shortening the distance of medical tourism, right? Because we have telemedicine now, and what is around the corner is very exciting. It's the metaverse. That's probably a conversation for another day, but this is happening, virtual reality and metaverse, where a lot of our future healthcare consumers are also not going to be willing to do it any other way, because every generation has its preferred way of interacting with the service providers. And I can tell you, Generation Z and beyond, they are just fully immersed in that digital approach of even taking care of their healthcare. I can tell you that the younger team members that I have, they care so much about mental health. You would be surprised, because a few years ago, when you and I were like younger, having a mental health problem was not something you would truly talk about in public. But that has completely shifted. It's probably for the better, because our Generation Z and our millennials, they care about that. And what I see is that they care about having a relationship with their therapist. They want to pick a therapist that gets them, that understands them, that maybe has the same background and ethnicity as them. and they will start searching online with that criteria as well. I want my therapist to have a certain knowledge. I want them to have a certain background. I want them to be comfortable with working with my point of view of the world. And that is where truly there's a lot of opportunity in medical tourism, and the distances can become very short. um, it also, you made me think about those people that are forced into medical tourism because they're, the term food desert, but there's, for lack of a better term that I would know now, there's also a medical service desert in some areas of the countries where hospitals, sometimes the only hospital in the area within a reasonable distance, has to close its doors. So yeah, so any thoughts about that before I want to touch on your recent publications in the media? I think
Yeah.
that is very interesting that we talk about that as well.
Yeah, so I just had a USA Today article that just came out earlier this week that is talking about people traveling for cosmetic surgery internationally. So many examples of people that are traveling to places like the Dominican Republic and Mexico and Colombia, and even farther abroad, such as places like Korea or Turkey or India, for cosmetic surgery of a variety of types. And by the way, that relates very significantly with mental health issues as well. In fact, that's a big discussion in the cosmetic surgery area around mental health. And then also just dropped today, this morning, a article in El Paso talking about a UTEP professor that had done a study of pharmaceutical costs both in Texas and in Mexico, and looking at the reasons why people are going into places like Mexico to be able to access pharmaceuticals at far less than they can in the United States. Many of these reasons, interestingly, are that people are traveling for medical tourism are not usually caused by the private markets failing them. In many cases, the private markets, whether it's the physicians, the dentists, the hospitals, do a good job of bringing the services that are needed by people in the regions that they need them. What typically happens is there tends to be regulatory burdens and government intervention that lead to people either needing to or wanting to travel somewhere else to get access to something at a lower cost. And that includes, for example, the pharmaceutical tourism. Most of the reasons that pharmaceuticals are more expensive in the United States are regulatory, also a slight social justice aspect to it that some people in the United States might not be aware of, which is the United States tends to overpay for the development of these drugs, which are then given at a much lower cost in places like Africa and Southeast Asia, where there are people and countries and regions that have a hard time affording these drugs. So a brand new cancer medication, the developmental cost would be borne by the American people more than it is even by the Europeans and Japanese and other people, so that these drugs are more available. And then there's also liability and other issues. So really fascinating. But in general, to get to your point about technology, the technology has been this wonderful enabler that is allowing all of us to get better access to the care that we need. So there's a couple of interesting points. One is for practitioners, for the doctors and the hospitals themselves. They, as I mentioned earlier, you've done such a great job in helping to highlight this, is that physicians and hospitals need help navigating technology, and particularly getting the word out. I was reading this wonderful article about the difference between Web 2.0 and what will be Web 3.0, particularly the metaverse and the various concepts around metaverse in NFTs and other things. And they suggested that the ultimate currency in Web 2.0, and still to this day, is attention. It's very difficult to get people's attention and to draw them in and to make them aware of the good work that you are doing in a particular area. You have to be out there. You have to be engaged. You have to be using some of these technology tools, social media and others, to be able to get access to people. So I was in Piedras Negras, which is right across the Texas border, across from Eagle Pass, very small town on the Mexico border. And there's Dr. Alvarez, who's a gastric surgeon, and he has performed over 18,000 surgeries in the last, I want to say, 8 years, mostly Americans. And he had so I went into his hospital, and he has a hotel that's above his hospital. And by the way, I had an article talking about how hotels add to your overall margins as a healthcare provider in a New York Times article that came out earlier this year. He had a hotel there, almost like a luxury hotel in the facility. He had a fleet of shuttles that would go to international airports in Dallas, in San Antonio, Austin, Houston, pick up people and bring them back, kind of VIP luxury service, all included, by the way. And then he also was very active in media. So he self-publishes books on Amazon. He has an entire marketing department. He's got a room full of hipsters, Mexican hipsters that do nothing but 24 hours a day, 7 days a week, help plan media events. They're active on social media. They're out there producing videos on TikTok and YouTube. And then in terms of his video production, he actually has a YouTube room. So if this is a physician, I got a picture of him standing in front of his YouTube room with the lighting and the audio and everything, so that he can help produce high quality videos to put out on his YouTube channel and also on the other sites that he has to promote his business. That is some older folks that are familiar with healthcare would say this is not healthcare. Well, it is healthcare. There's a lot of people out there that need the services that you're offering. And if you're doing an extraordinarily good job, the best thing you can do to do God's own work is to be able to promote what the good work you're doing, so that people know that there's alternatives, and that rather than having to select just an average practitioner to do something, you can get something different. And that comes to pricing and quality. What Dr. Michael Porter called the value equation, value-based healthcare, which is, are you getting the outcomes that you want at the pricing you want? And there's alternatives. Those alternatives may not be in your local area. They may be elsewhere, maybe international, but they may be just across into another city or out in the suburbs, or maybe into another county or another state. Alternatives are there. The technology, as you said, is bringing everyone together. Telehealth, the ability to find more healthcare information than ever before, and then these fascinating, wonderful, innovative free market solutions, which are also driven by healthcare. So I mentioned earlier Lasso software. I'm very proud of Lasso software, because what they're doing, and there's a couple other models in the US as well, that they're trying to develop a group of practitioners that are available to patients that they can then go out and choose. They can use a rating system very similar to what you see on Amazon or Yelp or Travelocity when it comes to a hotel. You can use rating systems and look at that. They're also trying to develop a value-based equation, where what they can do is you can actually select somebody based on the actual outcomes of that physician or that facility, so that you know you're getting a good quality healthcare service when you go there. There's just so much going on right now. We are truly in the golden, if not the platinum age of healthcare. And I wish more people knew it. Most people think healthcare in the United States is bad and getting worse. There's actually some really good trends out there,
Yeah.
and things are better than people think. Couple points, a little controversial, add a little controversy towards the end of our
All
session
right.
here, but this
Bring
will
it
be
on.
good. So many people say healthcare in the United States, you're getting bad healthcare. We're getting worse healthcare than we do in Europe and other places. It's actually not the truth. There's a couple of myths out there. For example, the idea of healthcare debt and bankruptcies. There was actually some research that was done by Elizabeth Warren while she was a faculty member at Harvard. It's since been refuted in other studies, including a study published in Health Affairs that shows that when the data that she had was self-report. So in other words, people that had credit card debt and house debt and car debt, when they were asked why they went into bankruptcy, they didn't say, "Oh, it was because I got too big of a house or too big of a car. I went out to Starbucks too often."
Mm-hmm.
So because of healthcare. So it was self-report, and it turns out people don't want to make themselves out to look more like a victim when they go into bankruptcy and not say, "Oh, it's because of other things."
Yeah.
The other thing is then the researchers then just said, well, shouldn't we have lower bankruptcy rates than Canada? And so they compared U.S. bankruptcy rates with Canada, and guess what? Canadian bankruptcy rates are higher than they are in the U.S. So that doesn't make any sense whatsoever because there is no healthcare bankruptcy in Canada, but yet their bankruptcy rates are higher. So that the research by Elizabeth Warren is not accurate in the way that it's used by most people. Another thing that most people don't realize, we realize here in Texas, and most people realize you're in New York or San Francisco, it's probably not as much of an issue, but we drive many more miles than people do, and you know this,
Oh yeah.
Europe, than people do in Belgium, in Switzerland, even in places like Germany where they still do drive, England, Japan. All those countries have much less miles driven by cars. And the number one or one of the top reasons why most young people get injured and or die is from car injuries in the United States. And if you look at population health statistics, when young people die, it brings the overall life expectancy rates down. So actually, in the United States, if you factor out or normalize the automotive accidents and injuries with European countries, in other words, to make them similar or to factor them out, we rise to the top of the list in terms of overall health care outcomes or expectations, life expectancy with European countries. So there's a lot of statements out there that are incorrect. And regarding public health care, when it comes to, say, Medicare for all, which actually in implementation would look more like Medicaid for all for most Americans, if you look at the outcomes that happen in states when they expanded their Medicare program, for example, the very famous Oregon study, the outcomes don't improve for people that got access to these public healthcare system. The outcomes only tend to improve where there tends to be better health care for people, meaning typically more free market healthcare. In other words, physicians with DPC practices, hospitals that engage in quality improvements that increase their quality, which then allow more people in the public to have better access to healthcare. So, when you cut through and actually look at the data, what tends to show up is the trends right now, which are being driven by domestic medical tourism and DPC practices here in the United States, the ability of people to travel both domestically and internationally to get access to care that they want or need. They're quite frankly, and the technology that involves all those things, including the ability of patients to get on portals, in groups, on forums, on Facebook and other things, and find better healthcare practitioners for their needs. All of that is truly showing that we are in a golden age of healthcare right now, and I'm just very proud and happy that myself, my family, my students have access to that.
Yeah. Wow. I have to admit, I didn't know about what you just revealed about the fallacy of the bankruptcies.
Yeah,
It's because it is actually often used, of course, also
yes,
it's a nice thing to say, to promote medical services, because that, but I didn't know it wasn't true. But I love that is the fact. And later on, if you will send me those links, I would
yes.
love
Yeah.
to dive into that.
The
And
other thing, the other thing we have to remember is the biggest contributor to your health, and we've had these conversations before
oh
because we're both very passionate about it, and Andrea is very passionate about this as well, is that social determinants of health. The actual physicians, the pharmaceuticals, the procedures that they do is only about overall about 20% of what happens in terms of healthcare for your life. So if you want to have a better life, exercise, eat better, have healthier, make healthier decisions. A lot of decisions around healthcare involve your lifestyle, your culture, your environment, the things that you do. If you're, I mean, some of the best things you can do is just eat better, exercise, be social, go out, talk to people, be involved in family, kind of the Mediterranean blue zone concept. That's the key to wellness,
mhm,
not just physicians. And
yeah,
if you look at physician outcomes through actual medical outcomes, the US is equal to everywhere in the world, all the great countries that you would think have great healthcare. The US is equal to that and actually better in some categories, for example, cancer outcomes.
mhm.
Uh, Physicians and surgeons in the
I'm
United States tend to be better.
I'm so glad you say that. And you know what? Actually, what I'm seeing is that all the free market physicians, they are actually starting to also say that.
Yeah,
And why? Because there is no longer a motivation that is not in line with them making a living. DPC physicians or free market physicians, they are being paid directly by the patient, and they have a vested interest in
yeah,
the patient being happy and healthy.
yep,
And they're starting to say, you may not need the knife, the surgery knife right now. You may need to increase your activity. You may need to have a healthier lifestyle. And I love that. I love that about the free market movement. And quite frankly, also capitalism, because that is really at the core of free market, is
yep.
because it exposes truth, it exposes efficiency, it exposes what works for people. And it would be remiss to not mention that at the base, you can do so much by having a healthy diet and having a healthy lifestyle. And what I like to remind people as well is, if you understand that fairly early in life, and it is never too late, but if you understand that fairly early in life, and I was blessed to have a situation where I had a chronic ailment, and then I needed to change my approach in how I take care of myself. If you understand that early in life, you have no idea. And I don't know, you may have numbers and studies around that, Dr. Vequist, but you have no idea how much money over your lifetime you save. It
That's
may
right.
just be the best financial investment you will ever do, because each time you eat healthy, each time you exercise, each time you take care of your mental health, you put a a coin in an invisible piggy bank that just grows throughout your life. And if it, I mean, I'm so glad you mentioned that. And
So yeah,
also,
health is wealth. So
yeah, and it can't be repeated often enough. And also, what you said, I hope I get to meet that doctor in Piedras Negras sometime, because I want to see that. This is something, by the way, I haven't talked at all about my business, but this is something that I try to do with healthcare providers, teaching them that so that they can be as independent as possible with a low time investment, to have a presence and influence online. And it's just going to be, and I also love how you said that the older generations in healthcare, they might say this is not healthcare, this is not the proper way of having this conversation. But it's wrong, because as you quite correctly said, exposing the information, letting the world know what value you have to offer is really, why would you go through the trouble of all those years that you study and work hard to get your medical degree, and then restrict your expertise, to not reach all the people and heal the world.
That's right.
And yeah, it's beautiful. um, Dr. Vequist, what are you most looking for if the audience wants to reach out to you? Where can they find you? And what opportunities are you interested in? Speaking engagements or research opportunities? Tell us.
You bet. So we're as a nonprofit university-based research center. We're obviously always interested in spreading the word about this kind of health-based or health care consumerism that's going on. So we're always interested in speaking about our research and the research that's going on in healthcare about this patient consumerism, health-seeking behaviors that extend beyond just a local region to find better value-based care wherever it may be. So obviously reach out to me anytime. You can find information about contacting me on medicaltourismresearch.org. You can also find me easily on LinkedIn and Facebook. It's very easy to find me and the center out there. And then the other thing is, if you have any interest in potentially being part of some of our studies, we do proprietary research. For example, right now we're working with one of the U.S. News and World Report's top facilities in the world to help find out, using population health statistic, help find out how many people are coming from other countries, say in Latin America, to the United States for various different types of surgeries. Believe it or not, that information is not widely available through government sources and others. So we're actually doing some proprietary research for them. We also have helped in the past countries. For example, we've helped Korea, and Colombia, and now Mexico develop national strategies around medical tourism or health tourism as a economic development tool. So we're interested in all those things. Please feel free to reach out to us. We'd be happy to partner with you and work with you. And again, we strongly believe that these free markets, particularly international free markets, and competition, and the idea of thinking about healthcare not only as this wonderful service that needs to be provided for everybody, men, women, and children, but also trying to find out ways to make sure that we get the best quality processes and procedures and services to the people that need that. And in medical tourism, we see that both people that are low income and high income also both travel for medical tourism, and there's substantial research on that from around the world. So anything we can do to help further these ideas and the information about this, we're happy to do.
Fantastic. And of course, there's always the comments in the videos. Wherever you see them, we will monitor those. And it looks like Dr. Vequist and I will do this every week, and then we will address your questions later on, definitely, even if you didn't get the chance to interact live with us today. Leave us your ideas and your comments and your questions, and we'll make sure to address those. Yeah, at this point, I believe we can release our viewers to continue with their afternoons, and we'll do so as well. Any final thoughts, Dr. Vequist? Thank you for your time.
Thank you. Thank you. And again, thank you for what you're doing in healthcare and helping to highlight some of these fantastic practitioners that really deserve our awareness and respect for the work that they're doing. So thank you for your part.
It's my pleasure. Thank you. All right. Well, have a great afternoon, everyone, and see you next week. Bye bye for now.
That's good. Bye.